Kano State has one of the lowest immunization rates in Nigeria. According to the 2021 National Immunization Coverage Survey, only 10% of children receive full immunization and 30% remain zero dose, completely unvaccinated. This leaves thousands of children vulnerable to life-threatening but preventable diseases. But change is happening. What keeps vaccines out of reach for these children? Supply challenges, long travel distances, and a lack of trust. And on the demand side, myths, misconceptions, and limited awareness discourage caregivers from seeking life-saving services.
Yankin da muke zuwa irin matsalolin da muke samu gaskiya shine kamar iyaye musamman maza wasu zaki ga ba sa san alluran.
Da a ce da kanki zaki ranga zuwa guri haka yayi nisa amma tunda dai ga guri ne ba za ki sha wahala ba duma wani abu da zaki aikacen ki na gida zaki yi sa akan lokaci ba tare da kin yi gaggawa kin tafi wannan samun abu.
Idan aka duba a baya yadda aka fahimci ita cututtukan da suke damun yara da yawa saboda rashin ilimin mecece ta ainihin cutar. Idan an zo da allura da ake tunanin za a baka magani sanadiyar baka san abubuwan da suka sa wannan cutar take ba, kuma da idan an yi wannan magani din ma'ana an yi ita wannan allurar rigakafi din da yawa ba san mahimmancin da ita wannan allurar take da shi ba. Amma saboda yau da kullum abinda an yi wa wani kaga yayi lafiya lau ba tare da ya samu wannan cutar ba, an kuma yi wa wani shi ba bai tare da ya samu wannan cutar ba, wannan ta sa alhamdulillah mutane suke ba da goyon baya ake yin wannan al'amari.
The state is doing it can to ensure that all vaccines are available, storage facilities are available, human resources are there 100% available. But you may notice an issue to do with cultural beliefs, norms of the society, and a lot of factors that bring Kano into this deterrent situation. And the state is doing the best it can with the support of supporting partners in ensuring that zero dose has drastically reduced.
We're fully aware of the magnitude of the problem. The challenge was that over 30% of children in Kano State had never received a single dose of life-saving vaccines. Now, from a leadership standpoint, our vision was clear. We needed to go beyond traditional interventions and adopt a solution that was both context-driven and system-sensitive.
To break these barriers, TAConnect, with support from the Pfizer Foundation, is working through the Kano State Primary Healthcare Management Board to deliver human-centered, community-based interventions that directly address both demand and supply-side challenges. In 2023, TAConnect, with funding from Pfizer Foundation's Global Health Innovation Grant GHIG7, implemented the accelerating vaccination uptake in children under 2 years in selected zero-dose LGAs in Kano State. What started as a rotavirus vaccination drive quickly evolved, guided by community input, ensuring children received comprehensive immunization in just one visit. The results were remarkable. More than 51,000 children reached in a single year across 1,244 outreach events. Missed vaccinations dropped by over 50%, thanks to a strategy that made immunization easier, more responsive, and more trusted. With the project's extension in 2024, TAConnect expanded into 6 additional LGAs, adding a new layer: reproductive, maternal, newborn, and child health wraparound services. These sessions, covering WASH, nutrition, and child spacing were co-designed with community input, ensuring they addressed real concerns in relatable ways.
As part of deliberate attempts to use your data to iterate and refine your program, which is intentional again by the way the whole program was designed, we realized that there was an opportunity with these caregivers. Not only that were we reaching much more members, but we knew that these women, when you look at what is called the content of the reproductive life cycle, these women also had all that healthcare services. They had restrictions too, particularly within the reproductive maternal and newborn, which of course immunization is a component of. And so we saw it as an opportunity to reach there with much more valuable services that would help improve outcomes, improve their own reproductive health outcomes, and by extension, their newborns. And that's what brought about the wraparound services. The wraparound services was meant for us to integrate key reproductive and nutrition and wash services into the immunization program, making an integrated package. We know where we are all headed towards integration. Integration brings much more efficiency, provides much more value for money.
Data has been a game changer. Through real-time monitoring, TAConnect and the state government have made evidence-based decisions that improved coverage and deepened community trust, delivering tailored, high-quality care to the most underserved. Through dialogue and partnership, the initiative has built deep trust and strengthened relationships between caregivers and health providers, resulting in higher uptake and a stronger, more inclusive system.
So we thought that we could also reach there with family planning, counseling services. We can reach there with watch services. Watch services particularly important for them to be able to preserve the ideal status, not of themselves, but also of their newborns, and also other reproductive health services. So the wraparound services speaks to integration. Integration speaks to more impactful services. Integration speaks to cost efficiency, speaks to more value for money. So from the donor perspective, it's more value for the funds that has been given.
Actually, with the coming of the TAConnect, when we look at the state baseline, a lot of improvement was achieved, thereby ensuring that all the interventions provided are in place. Number one, before making it to the wider level, beside rota, all routine immunization antigens were brought in, so that the good innovation done in phase 1 can also replicate in phase 2.
This work aligns with national strategies championed by the National Primary Healthcare Development Agency, and it's paving the way for sustainable government-led ownership. The goal is clear: reduce the number of zero-dose children in Kano by 30% by 2025. Through innovation, human-centered design, and partnership, TAConnect is helping bridge the gap in immunization. One child, one caregiver, one community at a time.